How effective is doxycycline for strep? Doxycycline, an antibiotic drug, can be an effective treatment for strep throat but is not usually the best or most recommended choice. A lot of this depends on the individual patient, particularly when it comes to his or her tolerance for medications that are generally considered to be better cures. Doxycycline for strep is usually most effective in children and people who have weak or compromised immune systems. Anyone with a tolerance for antibiotics or who has taken stronger drugs in this class before may not get very good results when it comes to throat ailments. This particular antibiotic is more commonly used in the treatment of acne and other chronic skin conditions. Strep throat basics. Strep throat is a medical condition in which the throat and tonsils get infected with and inflamed by strains of Streptococcus bacteria, which is where the strep name comes from. This sort of inflammation often feels like an ordinary sore throat, though the causes and recommended treatment tend to be different. Soreness caused by general dryness or irritation, as is often the case with the common cold, can normally be treated with throat lozenges or other over-the-counter cold and flu remedies. These won't normally kill the Streptococcus bacteria, though antibiotics are usually required for this sort of job. Doxycycline is such a drug, but it is one of many. Depending on the circumstances, a different choice might be more effective. How doxycycline works? Doxycycline is a member of the tetracycline family of antibiotics. It primarily targets low-grade bacterial infections and is most commonly prescribed to treat acne and skin conditions like rosacea, and may also be used to treat certain sexually transmitted diseases. In some cases, it is also given to combat malaria and can be an important part of Lyme disease treatment too. It typically works by launching a slow assault on bacterial strains in the body, wearing them down and systematically destroying them. People take the drug either in a capsule or as a liquid to be measured and swallowed. It must usually be taken at about the same time every day for a period of about a week. Antibiotics in the tetracycline family are often able to combat most sorts of bacteria, but they aren't always the best choice for strep because of how advanced and quickly mutating the Streptococcus bacteria tends to be. People might start to feel better while taking this medication only for the strain to revive itself and come back stronger than ever. Antibiotic classes. Antibiotic drugs are classified into groups based both on ingredients and methodology. They all work in basically the same way, but different groups tend to be more effective when it comes to specific types of organisms and bacteria. Antibiotics in other families, particularly penicillin, may be more effective in the treatment of strep throat since these may be able to more effectively keep up with the Streptococcus mutations. The classes, uses, and effectiveness of antibiotics is constantly evolving, though, which makes getting a professional assessment essential to finding the right medication. Side effects. Doxycycline for strep can cause a number of side effects. But in most cases, the worst thing is that it simply doesn't cure the underlying condition. People might feel better, but the bacteria could just be dormant. This means that it can come back, usually stronger than it was before, after a few weeks or months. Other adverse reactions can include skin rash, itchiness, and nausea, particularly if the drug is taken on an empty stomach. Importance of completing the course. Antibiotics are typically designed to work over a set period of time, and in most cases they kill bacteria according